Temperatures this year have hit record highs, and this has led to one of the hottest summers that the country has experienced. There has been no respite in the form of rain and showers that we usually get once the temperatures start touching 40 degrees. This has led to a lot of discomfort in the form of because of the excess heat. Now, discomfort due to heat is known by all, but the uh, but heat can also cause excessive sweating, which leads to dehydration, and dehydration in turn can have disastrous effects on the brain and its blood circulation. Good evening, everyone. I am Dr. Akash Prabhu, consultant neurosurgeon at WINS Hospitals, Kolhapur. And with me is the chairman and director of neurosurgery, Professor Santosh Prabhu. And today we will be talking to you about the effects that dehydration has on the brain. Now, to start off with some facts, the body is made of 60% water, while the brain is made of consists of 73% of only water. Now, we also lose about 2.5 to 3 liters of fluid per day in the form of sweating, urination, and when we breathe. Now, this volume has to be replaced almost exactly every day to ensure that your body functions properly and does not get dehydrated. Now, in a summer like are having right now, you can lose up to 5 liters of water, especially if you are out in the sun longer and if you have some form of exercise. It is important to replace the correct volume. Now, how will you know how much volume you are losing every day and how much to replace? I will tell you a very easy method to monitor this. You just have to look at the color of your pee. The color has to be light yellow, almost like water. That means you're very well hydrated and the body has enough play room to regulate itself. If it turns dark yellow, that means that you are dehydrated and the body is trying to retain water to compensate for the decrease in fluid. That will be an indicator for you to take some fluids and take a chill pill. Now, when you sweat, you not only lose water but also electrolytes, which are essential for functioning. Losing of electrolytes leads to symptoms like irritation, lack of energy, and lack of motivation. This has to be replaced. Otherwise, it can lead to many other things which can cause problems. Nimbu pani with little sugar and a pinch of salt is one of the greatest ways to rehydrate in a very tasty way. Coconut water and buttermilk are other alternatives that you can try uh, to stay well hydrated. The effects of dehydration on the body can be bad, but they can be disastrous on the brain. To tell you about the effects of dehydration on the brain, I ask Professor Prabhu to educate us. Over to you, sir.
See, brain is a very sensitive organ, and just as dehydration can play havoc with the rest of the body and the kidneys, brain can have very devastating effects because of dehydration. What happens is basically as we get dehydrated, the blood becomes thicker, and normally flowing blood does not clot. बहता हुआ खून कभी जमता नहीं है, मगर अगर हम लोगों को डिहाइड्रेशन हो गया तो द ब्लड बिकम्स थिकर एंड नाउ स्टार्ट्स क्लॉटिंग. सो इन द ब्रेन, right in the center, right here, we have a big channel of vein which is called as the superior sagittal sinus. उस चैनल में ब्लड क्लॉट्स फॉर्म होना शुरू हो जाता है. क्लॉट्स फॉर्म इनसाइड दैट साइनस, and as a result of which the pathway for the blood to go out of the brain gets clogged. It is a situation similar to the bathroom drainage getting clogged with debris and the tap remaining open. So the heart is still pumping blood into the brain, but the pathway to drain it has got clogged. So there's a back pressure. पीछे की तरफ pressure हो जाता है and it ruptures into the brain, and there are back pressure hemorrhages in the brain. These are called as venous hemorrhages or venous thrombotic hemorrhages. So these are the types of hemorrhages which occur if you develop dehydration.
Could you tell about the other causes of CVT? CVT is cerebral venous thrombosis, which
The
is
technical term for this thrombosis is CVT or CVST, that is cerebral venous sinus thrombosis. Because of this, there are hemorrhages in the brain, as I have told you, and there are many known causes. In women, particularly, there are some very specific causes. Women who are on oral contraceptives are known to produce these thrombosis and produce these hemorrhages. The second condition is when a lady is nearing her delivery time, there is the body has a natural mechanism to cause slight hypercoagulation. That means clotting बढ़ जाता है in order to prevent the lady from getting exsanguinated at the time of delivery. वो bleeding रुकाने के लिए भगवान ने अपने को mechanism दिया है कि blood की clotting बढ़नी चाहिए और बढ़ जाती है. But in some women, this fine balance, it goes haywire and blood starts clotting even after the delivery or during the delivery, and this is one very important cause in women. As far as men are concerned, the commonest cause is dehydration, and because of the summer, about which Dr. Akash has already told you, people forget to rehydrate themselves and the blood becomes thicker, and these clottings start happening in the sinuses of the brain, because of which hemorrhages occur. One very important factor in men, especially in men, is alcohol consumption. What happens when you take alcohol? Actually, alcohol is a diuretic. That means it produces excessive urine and throws out water from the body. This is one mechanism because of which you get dehydrated. The second thing that the alcohol does is it even has effect on the pumping of the heart, and because the pumping is not happening properly, the flows in through the cerebral sinuses are disturbed and are slowed down, as a result of which clotting occurs. So these are two or three very important things. One other thing which I want to bring to your notice is on long haul flights, this uh, cerebral venous thrombosis is very common. The reason is, one, you are sitting in a flight for a long time and you are not exercising your legs. It is normally your calf muscles which are pumping, and because of which the blood from the legs also is moving up. Second important reason is, when you are in a flight, the flight may be at an altitude of 33,000, but the pressure inside is roughly 12 to 13,000 feet altitude pressure is maintained. So you are losing more and more water, and because of the low pressure, dehydration occurs. So these are the important causes. And finally, some people are having a condition called as a hypercoagulable syndrome. That means उनकी blood में coagulation होने की internal mechanism ज़्यादा होता है.
yes. Now, Ms. Sushmita has asked, what are the treatment options of CVT? First of all, I will tell you the symptoms of CVT. How, in case you may be suffering from this, how to identify you or somebody else around you. First, there will be mostly be some sign of dehydration. They have not had water. They have been out walking in the sun, exercising. They have been binge drinking. These will be the signs. Then they will have headache and vomiting, and the signs are slow to set in. So this may be happening over 2 to 3 days, which gives you time to come and seek adequate treatment. These are the two main signs: headache, signs, some clue of dehydration in the past 2 3 days, and vomiting, which further leads to dehydration.
Visual blurring is another symptom, and I wanted to add something at this point in time. The subtle symptoms of cerebral venous sinus thrombosis, especially after binge drinking, are similar, very similar to a hangover. The patient has headaches, he has dryness of mouth, he starts getting slightly confused, and it can be misconstrued to be actually a hangover when this sinus thrombosis is occurring. So, if there are symptoms like that, it would be best to seek the opinion of an expert on this.
मिस्टर नारायण विचारतायत व्यायाम करताना हायड्रेटेड कसे राहायचे. Would you like to say?
कसा है व्यायाम कर इन्होंने पूछा है कि मैं कसरत करता हूं तो हाइड्रेट कैसे होना है. तो व्हेन यू आर एक्सरसाइजिंग स्पेशली इन दिस काइंड ऑफ अ वेदर, आपने बीच बीच में लिक्विड्स लेते रहना चाहिए. यू नो, सम काइंड ऑफ हाइड्रेटिंग सॉल्यूशन आपके पास उसकी बॉटल होनी चाहिए, आइदर अ प्रोटीन शेक और समथिंग लाइक अ इलेक्ट्रोलाइट सॉल्यूशन, जो आपने ड्यूरिंग एक्सरसाइज, अगर आप बहुत स्वेट कर रहे हैं तो उसको पीते रहना चाहिए ऑन अ रेगुलर. यू नो, यू शुड कीप ऑन सिपिंग एट योर बॉटल.
Yes. Um, uh, there's a question. How do you know if you're sufficiently hydrated? Now, I told you one of the factors is by seeing the color of your urine. If it's very dark yellow in color, that means you're dehydrated. And at that moment, you will also be putting out less amounts of urine. You should be peeing at least 2-3 times, 4 times per day, and it should be of an adequate quantity. If that is reduced and it is dark, then you are dehydrated. Some other signs are your mouth will feel dry, and you will feel tired and restless, like there are no like you have no energy. Now, somebody has asked, how do I improve my hydration with food habits? What food should I consume to improve hydration of my brain?
Well, there's nothing special. As we said, you keep on drinking adequate quantities of liquids, which may be water, buttermilk, anything, you know, anything of your choice, anything except alcohol. आप कोई भी इस किस्म का लिक्विड ले सकते हैं, which will keep you hydrated. And a very simple monitoring method he has told: if your urine is coming of a, you know, pale yellow color or like tap water, you are adequately hydrated. If your urine is looking dark yellow and you're bringing out less quantity of urine, you are dehydrated. Pani piyo.
Apart from alcohol, coffee and tea also cause dehydration. So I know there are many chai lovers and coffee lovers who have more than 2, 3, 4 cups of coffee a day. So make sure you also have water in between that, so that you don't get dehydrated. Uh, Somebody has asked, does dehydration lead to low sugar? So dehydration itself does not lead to low sugar, but if you're dehydrated, you're probably not eating, you're not drinking enough water, and you're probably not eating enough also. So you may have low sugar at that time. So these almost go hand in hand. Now, um, some other questions. Does our body give us signals about dehydration?
Yes, we have already talked about them. First thing is you will feel thirsty, your mouth will become dry, your urine will become dark colored, and in if you are heading, your dehydration is heading for brain related problems such as thrombosis, then I told you, you will have a headache, you will have visual blurring, you may get seizures, you may have an altered sensorium, uh, and if actually the hemorrhages occur, one side of the body can get paralyzed also.
Yes. Now there is a question. What are the treatment options of CVT? So one of the first of all, it is prevention is better than cure, and the prevention for this in most cases is very simple. Just stay hydrated. If the heat is more, make sure you drink enough water. At least 3 liters per day is good. And when if it is summertime, if you're exercising out in the sun more, you should increase it more and monitor it with your urine color. In case somebody does end up getting a CVT, it is pertinent to seek immediate medical help. You can go to a neurological center equipped with dealing with these emergencies, where they will get a scan of your brain, either a CT scan or an MRI, in which we also get a venogram that gives us a picture of only the veins, the sinuses that we talked about, and we can see exactly where the blockage is. Now, many times this leads to not only the blood thickens and stops stops
Slow down.
supplying to the brain, and later, like a high pressure blockage, it opens up and there is some bleeding there. So this can again be add a lot of problems to a already big problem. In this case, we you will get admitted and you will be given enough hydration, and you will be given blood thinners. But because you have already bled and there may be more pressure in your brain, you may also require emergency surgery to relieve that pressure. So these are the treatment options. Some other questions are: does age and gender affect the risk of developing CVD?
I have already mentioned this, that there are certain conditions in women, such as delivery and the period, the puerperal period. That means the period after delivery, around 3 to 4 weeks of period after delivery, where this body has a natural hypercoagulation mechanism to prevent bleeding. That is the time when most commonly women develop this particular condition. In men, we have already discussed the factors.
Um, there are questions which ask that are there any food items that cause dehydration or any food items to eat to avoid dehydration? So one of the things is eat fruits. Fruits like watermelon have a very high water content. I think almost above 90%. So it will be akin to drinking water in an enjoyable form. So eating fruits like watermelon, vegetables like cucumber, tomato, all have a lot of water content. So you can have them. Tard gola, which is uh, ice apple, is a summer delicacy that I look forward to eating every summer. That is also a very tasty way to stay hydrated. That is basically like eating water.
Everybody's favorite mango is also actually any fruit for that matter, because fruits contain a lot of liquid and water inside. So any fruit which is juicy is going to provide you with adequate water.
And about food items that cause dehydration, a lot of if you have are used to eating a lot of noodles and a lot of processed foods, they are usually in dehydrated form. They have a lot of salt and fat content. So salt as well as fat tends to absorb 3 times its amount in water. So that water will be absorbed from your gut and it will not be available to you for your body to consume to stay hydrated. So these foods should be avoided because they may cause excess dehydration. There is a question: does being overweight lead to dehydration?
Yes, obesity is one of the factors which can cause a hypercoagulable state and can lead to these coagulation related disorders in the body. So actually obesity is a thing to be avoided because it causes all kinds of problems in the body, and so it also causes this thrombotic condition in the brain.
Uh, a very special uh, participant has asked: do long hours in air conditioning cause dehydration? So no, actually, air conditioning is controlled air conditioning. So it actually regulates the humidity in a room and sets it to an almost ideal level. So air conditioning itself will not cause dehydration, but sitting for long hours anywhere without having water may lead to again getting dehydrated. As far as flights are concerned, because you're the what sir said, that you're at a higher pressure altitude, that leads to dehydration. So it is very important to keep drinking a lot of water on flights, and especially if it's a longer flight, you should avoid alcohol because that will lead to exacerbation of this dehydration. So I think we have dealt
There
with
is
most.
one question here. Uh, दीर्घकाळ मिसेस गीता हैज आस्क्ड दिस क्वेश्चन. दीर्घकाळ पाणी न पिणे हे उच्च रक्तदाबाचे कारण असू शकते का? द क्वेश्चन इज, अगर बहुत देर पानी नहीं पिया तो क्या उससे बीपी बढ़ सकता है? नॉट ट्रू. पानी ना पीने से ब्लड प्रेशर बढ़ता नहीं है. दैट्स नॉट करेक्ट.
So, I think to summarize, it has been a very hot summer, and we should remember to take care of our health and ourselves. Drink a lot of water, eat the summer fruits that have been given to us by nature, like watermelon, mango. Enjoy ice apples, buttermilk, and nimbu pani, and you will not be dehydrated, and you will avoid all these problems that we spoke about.
And keep drinking water all the time.
My glass is over. So I think with
Thank
that,
you.
we will end the session. Thank
Thank
you
you very
everybody
much.
for participation.